Hello, I am so happy to have you with us today. For everyone who's watching, I would like to introduce you to Dr. David Manchel. David is the owner of Mindful Psychology and Wellness in Commerce, Michigan. He is also a board member on the Lakes Area Community Coalition Board of Directors. And we are so happy to have David talk today a little bit with us about men's mental health and risk of substance use and general men's health and wellness, especially right now during the coronavirus pandemic. We're all under a lot of stress and a lot of strain, and we recognize we have unique challenges right now. And today we're just going to talk a little bit about how that affects men in particular. So, Dr. Manchel, if you would, tell me a little bit about your background and your experience with men's mental health issues.
Sure, and thank you, Joan, for having me here. It's my pleasure, as always, to be involved with Lakes area. And so I'm a psychologist. I'm a clinical psychologist. I've been in practice for about 25 years or so. And I have worked with a lot of different people, but I have worked with men over the years. And what's important about men's mental health is the idea that is true that a lot of boys are not raised to talk about emotions, and that carries on through childhood and through teenage years and into adulthood, where men basically feel like it's not okay to talk about emotions, that that's something that women do, and men keep their feelings to themselves, which is not a healthy coping skill.
No. So, in your treatment and working with men right now, what are some of the big concerns that you see men dealing with right now during this crisis?
I think the idea of not talking about emotions is intensified. There's no doubt that what's happening right now affects people in so many different ways, financially and psychologically and medically. And for men in particular who are not comfortable talking about emotions or even acknowledging them, there's really no way out of this now, that we are being affected. Men are being affected, and it's really important to emphasize what emotional health is. And a lot of the times, emotional health is being able to talk with someone about how you feel, not avoiding or isolating or even minimizing emotions that we can do.
Yeah. How about our young men? How do young men struggle at this time in a different way, maybe than their fathers or grandfathers might?
Yeah, young men, or even we talk about boys who are in their later teens, still are under pressure, really not to talk very openly about emotions. So, for a lot of young teenagers or young men, we can see a reliance on drugs or alcohol as a way to what we call self-medicate, to try to make feelings go away, or to make them not as important. And that's what drinking or doing drugs often does for a lot of the young people I speak to. A way to alleviate anxiety. It's a way not to have to face certain realities. And we know that that just creates many problems unto themselves. It's not healthy coping.
Yeah. There are lots of unhealthy things that young men or men in general might do. What are some of the unhealthier things that men might be able to do to cope with stress that are counterproductive that you may have
Mhm.
seen? And then what are some healthier alternatives that they
Sure.
could do instead?
Yeah, that's a great question. Unhealthy, of course, would be using unhealthy behaviors to try to cope with uncomfortable emotions. So when I talk to young people, one of the things I'm often talking about is it's okay to admit and to talk about emotions that we don't like. Everybody feels depressed at times. People feel anxious. If a young person is um, drinking, for example, which is very common, or smoking marijuana, or doing other types of drugs as a way to not feel the emotions, I say that's not advisable. It's not a healthy way of coping. Um, Healthier ways of coping. If professional help is needed, certainly being able to talk confidentially to somebody about issues that maybe they can't talk about with anybody else, I would say is extremely important. If they have friends or family or others that they can talk to, I think that is always a much healthier option for them to do.
What would you recommend in terms of physical health at this time to support
Mm.
a young man's mental health?
Yes, exercise is always a great a great behavior on different levels. On the one hand, it creates endorphins, our own healing hormones and chemicals to surge through our bodies. It keeps us, it helps bolster our immune system. I think those are very healthy behaviors. Going for walks, being out of the house, trying to avoid the isolating effects of being on kind of home shutdown that everybody's going through. I think those would be really healthy alternatives.
Very good. Who are good supports for men who struggle with mental health or with substance use issues? Who are some good supports for them?
Mhm.
And what can these support people do to help the men in their lives?
Yeah, very, very important. I talk a lot about support networks with men that I work with. If a man, for example, is someone who does struggle with substance abuse, support groups like AA, Alcoholics Anonymous, Narcotics Anonymous are great great forms of support. They're anonymous. It's a great network. In addition, if somebody in their personal life has family members, friends that they can turn to, that they can be honest with, that's a big part. Sometimes people don't like, they feel that they're burdening friends or family with personal issues, and they would rather keep that separate, and that's okay. There's professional help available as well. Therapists, another confidential and private place for someone to go to be completely honest and not have to fear that they're going to be judged or somebody's going to be talking about them. I think that confidentiality aspect is very important.
Yeah. That's great. We really appreciate your time with us today. We appreciate that you care so much about the men in our community, and that your professional and your personal life is also committed to our organization and helping us build a community of strong, healthy men today and for
Yes.
the future. Thank you so much. We appreciate your time, and we want to remind everybody to check out our website where resources for sobriety and for mental health are all available. Links and phone numbers for everyone to reach out if you or someone that you love is experiencing some extra trauma right now during this time. So check us out at lakesareacc.org. David, thanks so much for your time.
Thank you. My pleasure.
Thanks.
Bye-bye.